Parent Connect. Today, parents, we are going to connect with Dr. Wanda Hannon, the Health and Social Services Supervisor. Health and Social Services Supervisor for the Mobile County Public School System. And something that you all parents probably are not aware of, the many programs that fall under Dr. Hannon.
That's correct. We have lots of services that a lot of parents need, but they don't necessarily know to ask. And what we try to do is educate the employees at the school system, because there's not a nurse or a social worker at every school.
Right.
So we try to work with the principals, the assistant principals, and especially the counselors and registrars to educate them on what questions to ask parents.
So they can pass down the information.
Exactly. And we're not being nosy and trying to get in parents' business,
No,
but we're trying to connect them with the services that are available in Mobile County.
Right. Well, that's a great thing. So what are some basic services?
Okay, for health services, we have a registered nurse that is assigned to every school. So that registered nurse oversees to make sure the children have had all their immunizations, that they're healthy, and that they're ready to come to school.
So let's stop for a minute, Dr. Hannon. Immunizations.
Yes.
So that's a big thing, because some parents think once you do that, you know,
It's
going
a
into
one-time deal.
Right. So what's the policy?
Well, it's almost a one-time deal. If you have all of your immunizations before you hit kindergarten, then you don't have to have another immunization until you reach around age 12.
Wow.
So there's just 2 times that you need immunizations
During
if the
school.
child starts at kindergarten level. There's only twice that they have to have immunizations: before they come in, and then again at 12.
Okay.
So once you do the registration, you take the blue card to the school, then the nurse at some point checks it to make sure
That is
the
correct.
child's up to date with
That's
all their
correct.
shots. Okay.
And we have a lot of changes coming this school year because the blue card is no longer going to be blue.
Whoa.
I know.
That's very different.
It is.
It's always been the blue card.
Everybody talks
Now
about the
parents
blue
know.
card. Well, now the blue card can be white. So the doctor's offices or wherever you get your immunizations, then they can print it off on white paper, and they just bring it onto the school as if it's blue. That's right.
Okay.
Always about technology. And the school nurses now this year are going to be able to look and see on the computer what you have and what you need, and that's
Because they've been scanned
another
through.
one. Well, no, they're giving us special permission. The Alabama Department of Public Health is giving us special permission, and if the child is up to date on their immunizations, we can even print that blue card. It's now called a certificate of immunization, and we can print that certificate of immunization if the child is up to date with their shots. And there's a lot more places where they can go get their shots now. You can go to CVS or Walgreens and places like that. They're
The
now
health department.
giving
Okay.
some. The health department is changing. The Mobile County Health Department is changing. They're no longer going to issue your certificate of immunization or your blue card if they did not give you your shots.
Okay.
So you
But
have
that
to
is a place
go.
where you can go to get them.
You can go and get them there, but something new. There's no longer an immunization clinic at the health department.
Okay.
You
That
now-
is very important
It
for
is.
parents to know.
It is. Now you have to have a doctor's appointment to get your immunizations.
Okay.
So you can't just walk in and say, my child needs his school shots. They have to actually see a doctor now.
Wow. I'm glad we kind of paused there, Dr.
Me
Hannon.
too.
That's a lot of great information.
And-
And that's just a snippet. So what
Yes.
else lies within?
So every parent, whenever they go into online registration, because I'm also in charge of online registration in my department, but they answer a series of questions, and it's called a health history.
Yes.
The state of Alabama requires all parents to answer that. And so the nurse reviews that to make sure that every child is healthy and ready to come to school. If a child has a condition that requires that child to get nursing services at school or something that might affect his school day, then the nurse is required by the Board of Nursing, the Alabama Board of Nursing, to do a healthcare plan for that child.
For that specific student.
Yes, for the condition in which it affects their school. So if a child has asthma and he has to have his inhaler with him or his medication with him at school, then the nurse will contact the parent and they together will develop a plan of care for the child at school.
And is there any forms that the parents have to fill out in order to leave the medication at school?
Yes, medication is a whole nother ballgame. Medication has its own forms, as well as nursing procedures. Say the child needs a tube feeding at school. It has its own little form. So the parent needs to fill out the form and come to the school and meet with the school nurse. And
so this is where they'll develop their plan on what to do with the specific condition the child has.
Yes, and the schools that don't have a nurse on board full-time every day, they will see the person in the office and they will direct them to who they need to talk to with their medications. Parents cannot have a child bring medication to school. The parent has to bring the medication to school. The medication has to be in the pharmacy container. It has to have the child's name on it, the doctor's orders on it. So, and the doctor actually has to sign the form.
And that includes a cough drop, correct?
No, that does not include a cough drop.
Can kids bring cough drops to school?
Yes, kids can bring cough drops to school.
That is very important to know.
Yes, it is not. We discourage them bringing any over-the-counter medication. They cannot bring any medication to school. They cannot bring any over-the-counter medication to school. Parents will put a pill in a baggie, like a Tylenol, and say, take this at lunch. That's a no. They cannot do that.
Okay.
So.
All right, parents, I hope you all have your pens and notepads and that you're taking notes. We're getting some great information from Dr. Hannon. And when we return, we will continue to talk with her about what's available under the Health and Social Services Division of the Mobile County Public School System.
It is an exciting time of change in the world of education, where technology is being used to engage our learners. And here in the Mobile County Public Schools, we're embracing those changes and moving forward into this new era of learning. It's our vision to be the premier educational system where students engage in multiple pathways, leading to success in a global society. Education for the future. It starts with us.
Smartboard, that's right.
Parent Connect, conexión a padres. Cualquier pregunta, comentarios o si necesita información en otro idioma aparte de inglés, por favor llame al 251-221-5184. Mantente conectado.
The more parents are involved in school, the more likely it is a child will succeed. Children with involved parents and attend school regularly make better grades and have better social skills. Every involved parent makes a difference.
Get involved. Ask about your child's day. Explain how your education matters. Parent involvement, it matters.
You can find more information on parent involvement at mcpss.com.
As Alabama's first and largest school system, Mobile County Public Schools prides itself on the high quality of education we provide our students.
We have been successful over the years in raising our graduation rates
and have been recognized nationally for closing achievement gaps.
We believe that our primary focus is to educate all students to become productive citizens.
This is our commitment to them and to you.
Welcome back, parents, as we connect today with Dr. Wanda Hannon. Dr. Hannon, I'm just on overload now.
Much information.
Yes, so much great
For sure.
information, because no longer the blue card, certificate of immunization.
That's right.
So what else do we have available under health and social services?
Well, it's the nurse's job to hopefully have a healthy student, a healthy teacher, and a healthy environment. So if there's anything that a parent needs, they need to always connect with their school nurse when it comes to health-related things. We talk to doctors all the time. There's new laws with the diabetic children who come to school, and what their services are at school and how we can best manage that. And we talk with the doctors a lot, and to let the doctors know, because they don't know what goes on at school.
No, they don't know all the policies and the way things function at school.
Well, we have the children 7 hours a day, so you know, they need to know what's going on in that school environment for that child, so that they can best decide what kind of care that child is getting. So we keep up with all of those sorts of things, and we refer out. We do scoliosis screening for children in grades 5 through 9. Every year they should have a spinal screening by the PE teacher and the nurse, as well as we connect them with any other things. So
a lot of partnerships.
A lot of partnerships. So it's our job to be the liaison between the school system and the medical community, because children that used to unfortunately not make it in life, they're now coming to school, and they're coming to school with medications, with things that nurses have to do for them, as well as different machinery. We have children with respirators, we have children who have trachs, we have children with different exceptionalities and medical conditions. So the nurses are there to make sure that everybody is educated on how to take care of that child, as well as to make sure that that child's getting everything he needs at school.
And these are some plans that between, like you said, the nurse and the parent, they agree upon to make sure that, of course, you know, as a parent, that you feel your child's getting the best care. Not only the education side, but their physical, medical care as well.
That's right, because if a child is unhealthy, the child's not going to be learning.
Exactly.
So we want to make sure that everybody is as well as they can be
in order
while they're at school. Some other services, we have an audiologist on staff. And so if a child needs their vision and hearing checked for either just general purposes, we do a preliminary check. Now, we don't do the detailed one that the doctor does, and the audiologist is there to look at the hearing screening.
Do you find, Dr. Hannon, that there are some students who, if it wasn't for that screening, we would not be able to determine?
That is correct, because some children don't go to the doctor as much, and children don't know that they can't see, because that's normal for them. And so we have children that after they get their glasses, they're just like, oh, there's leaves on the tree.
There's so much more to see.
There is so much more to see. So in a hearing problem that comes up later in life, I know that they do hearing screenings now on babies, but whenever they get a little older, they don't necessarily do that. And the parent goes, oh, he's just not listening to me.
Right, not paying attention.
When maybe he could have had a virus that affected his hearing, and the parent does not know that. That's the same way with the spinal screening. How often do you see your children undressed once they get a certain age?
Exactly, you know, and you don't think to see, okay, is everything well, or ask the pediatrician, can you check this?
That's right. So
it's one of those great services from school.
Yeah, so there's a lot of things that we do that kind of, you know, can put it all together for parents and kind of help parents out.
And then if you find that a child has a problem with the vision or hearing, then you let the parent know with some type of letter with a referral to let them know, go see your doctor.
That's right. And when we tell them where they can go and see, not only their private physician, but if they need a specialist, we will let them know that. You know, and who specializes in that sort of thing. So that the parents always have a choice. We are not there to be the parent. We're not there to be the primary care provider. We're the eyes and ears of parents and the eyes and ears of the physician.
And at least let them know this is what's going on. Now it's up to you to go see another doctor or specialist or whatever the case may be.
That's correct. And there's also a law, and switching gears now with the social workers, we have 4 social social workers now that help with the homeless population of children. So if you have a fire, if you're out of your home because you lost your job and can't afford your mortgage any longer, then there's a law, it's the McKinney-Vento law, and it provides for children at school. So maybe you had a fire at your house and you have to go live with your aunt, and your aunt is in a different school. Well, those children have the right to stay where they are. So don't be uprooting your children before you talk to us. Please contact the school and tell us your needs. And hopefully we can offer stability in these children's lives where everything else is turned up.
Like that.
Yeah.
Exactly. That is the most consistent, where your kids are in school and then going to school.
During a hurricane, during a flood, during a fire,
Any type
those
of
sorts of
disaster.
things.
And I think, Dr. Hannah, something you said earlier on, we're not trying to get in your business.
That's right. We're not.
And we want parents to understand confidentiality is the very first rule. And it's because we care and have all these services that are available.
That is correct.
That
And we don't tell children's business even to the teachers and the principals. We tell if they need to know. If that principal or that teacher is making a difference in that child's life for that issue, then we will let them know when we need them to know. So if you are living in a motel, if you're living in a tent at a campground, please let us know, and we can handle it very confidentially, but we can help you get to those resources that are in the community. 15th Place is a wonderful place for homeless people to be connected, and they will have an address and they'll have other services that are available there. And that opens up even more resources that the County of Mobile and the City of Mobile have for them.
Right. Wow. Parents, we'll be back with Dr. Hannon with some more information. Dr. Hannon, this is just so much. It's wonderful. And we'll continue when we come back after break. Thank you.
The Mobile County Public Schools Signature Academies program offers a variety of specialized curriculum for highly interested and motivated students. These academies provide students with choices ranging from aviation to healthcare, advanced information technology to international studies, from engineering to coastal studies. These high-quality hands-on programs prepare students for careers readily available in Mobile County. Signature Academies program. It starts with us.
welcome back, parents, as we continue to connect with the Mobile County Public School System's Health and Social Services Division. Joining Dr. Hannah, we have Nurse Sharon Bailey. Welcome, welcome.
Thank you.
So now we're going to kind of put it together. There's so much that goes on within that one division. And Dr. Hannah, you've said so many key things, and they all lead back to healthy children in school. And you also mentioned teachers and the support staff. You all are there for all of us. Just, you know, we can't even talk about the 59,000 students because then you have to add on the adults.
Yes.
So from the local school standpoint, how does that, what's a great place to start with giving parents some key information so they better understand how it works?
Well, we just need to connect with the parents like we're doing today with this show. And then parents need to really look at the information that we give them at the school. They get a handbook that outlines a lot of things just minimally. And then if they require more information, please come to the school and talk to us. We're more than happy to do that. Yes, and if the nurse is not there, the school knows how to get in touch with a nurse that is assigned to that school, and we will be more than happy to talk with them. We work. Sharon and I work 12 months, so we're there during the summertime as well. So we can always be reached at the office. So we're more than happy to help them. We want parents to try to take care of their business in the summertime with their doctors and come to us if something has changed with their child. Please give us a call because we want day one, come August the 10th, to be in that classroom, and I want the nurses to be ready to take care of them. So I don't want to tell a child he can't come because I don't have a doctor's order yet. So we need the parents to come to the school and talk to the people at the school or call us, and we can get the ball rolling. Right, and there's this misconception on the last day of school everyone stops working. And that is so not true, because when you all are working, that's critical, but you also need parents to continue to work. Yes, we do. We need them. At the end of the school year, the school nurses should have given the parents the new paperwork for the upcoming year. But there is a new law that says that the paperwork now is good for a calendar year. So if the mom just gave it to us in March, well, it's good till next March.
So the following
so
year.
Everybody doesn't have to do everything for August now. And then whenever they get it, they bring it to the school and the school nurse. And Sharon's going to talk to you about what we do with the paperwork and how we rely on the children and we help educate the children. And the
Nurse
children
Bailey,
come
that's
see
the
us.
question. When the parent comes to school, they already have their form filled out. This is the medication my child has to take. They give it to you. Then what happens from there?
Well, if you're fortunate enough to be in a school where there is a nurse full-time, then that nurse will be responsible in making sure that your child gets his medication every single day. If your child has a procedure that needs to be done, such as tube feeding, you're an asthma child with their inhaler, we're going to make sure that that's taken care of.
You keep all the medications in the nurse's station.
We keep it locked in a file cabinet or in a cabinet. It's always secure. And then we have specific state paperwork, a daily log, that each time we give your child his medication, then we will log that we have given it. We also have a record in our computer system now that we log that we have given it. So we have check systems.
And then does the child just come to the nurse at that time they're supposed to have the medication?
Well, at first that's a little problem. They're getting used to us and we're getting used to them. But it is, once we take that medication, it's our responsibility to make sure that it's given
at the set time.
So, and we want to protect their privacy as well. So the nurse will go get that student and walk them back up and give the medicine. And hopefully, especially our children that have to take inhalers, for instance, before PE, they'll get in the routine of coming, on
Just
their way to
stopping
PE.
by on the way.
Stopping by, yes. But it's our responsibility to make sure that they do get their medicines.
And then what about other things like, my child fell and had a scrape, or, they hurt their finger, or they tripped and fell down. What about those things? The nurses also handle those.
We take care of that. If we think that it's something that needs to be looked into, maybe we think you have a cut that may need a stitch or whatever, we're going to call the parent. I always call the parent if a child should get a bump on the head or whatever, just to let them know what's going on and what to watch for. And then while they remain at school, which is our goal, to keep them in school.
Say that one more time. The goal is
to remain in school. We would like, we'll watch them the rest of the day, and if anything shows up. But we like to call parents and let them know what is going on or what we have noticed. The teacher sometimes will send us a child that they're coughing persistently or whatever, and so we'll evaluate that, and then if we think the parent needs to know, we will definitely let them know.
Wow. So much information and just a valuable and invaluable part of our program, because we do want to keep our students in school and we want them healthy. Ladies, we cannot thank you all enough for joining us. And parents, we truly hope that you all have connected and that you've taken some great notes. And I want to go back to Dr. Hannon saying, contact them.
That's correct.
And also begin with your school and contact the school. There are no dumb questions. Make sure that you ask, because you and your children are important to us. Thank you, Carmen.
Thank you.
Anything you want to leave with?
Just make sure that you don't send your child to school with a fever.
Absolutely.
That's right.
All right. Thank you all. Thank you, and have a great day.
Hello, I'm Martha Peak, Superintendent of the Mobile County Public Schools, where our students are achieving great things. The Lady Rattlers of LaFleur High School are the 6A Alabama State basketball champions. We also have students who are the top vocalists as well as top journalists in the state. We have excellent student chefs who compete in a variety of culinary competitions, showcasing student talents. It starts with us in the Mobile County Public Schools.